Acute appendicitis stands as one of the most frequent surgical emergencies globally. This condition arises when the appendix, a small pouch attached to the large intestine, becomes inflamed and infected. Left untreated, that inflammation can escalate, rupture, and spark dangerous complications. Yet, with early diagnosis, appendicitis is highly treatable. Let's break down what you need to know. Abdominal pain is the classic warning sign. It often begins near the belly button before migrating to the lower right abdomen, a shift that offers a vital clue. Other symptoms include loss of appetite, nausea, vomiting, mild fever, and abdominal tenderness, especially in the right lower quadrant. Movement, coughing, or even walking can intensify the pain. However, symptoms aren't always textbook. Children, elderly patients, and pregnant women may present differently, so vigilance is key. Diagnosis starts with clinical skill. Doctors assess patient history, perform physical exams, and look for tenderness at McBurney's point. Blood tests frequently show elevated white cell counts, indicating an infectious process. To confirm the diagnosis, imaging is essential. Ultrasound is preferred for children, while adults often undergo CT scans for more accurate results. Rapid, precise diagnosis prevents rupture and complications. Appendicitis treatment centers on surgical removal, called an appendectomy. Today, laparoscopic surgery dominates. Its advantages are clear: smaller incisions, reduced pain, quicker recovery, and shorter hospital stays. In rare, carefully selected cases, antibiotics may suffice, but surgery remains the gold standard for definitive treatment. Delay can be dangerous. If the inflamed appendix ruptures, it can cause peritonitis, intra-abdominal abscesses, and even sepsis. These life-threatening complications demand urgent care. The message is simple: timely intervention saves lives. Acute appendicitis is common, serious, and highly treatable. Recognize the symptoms, seek care early. With prompt treatment, recovery is typically swift and complete.